Hello, welcome to the University of California, San Diego Chronic Kidney Disease Program. My name is Norma Regev, and I am a licensed clinical social worker. Our healthcare team includes a nephrologist, pharmacist, nurse, social worker, and a dietitian. My role is to help educate patients learn about kidney disease and the treatment options available to them. This is one module of a 6-part series discussing treatment options for failing kidneys. In this module, I will talk about peritoneal dialysis. Our goal is to help empower you with knowledge to make informed decisions about your kidney treatment choices. We know that needing to consider kidney treatment options can be a big decision. It gives some people hope to know that there are treatments today that can help them live long, well, and maintain a good quality of life. Peritoneal dialysis is one of those options. In addition to medications and dietary recommendations, your doctor will help you choose what treatment option is best for you based on your current health and treatment goals. There are 3 main types of treatment for failing kidneys. Those include transplant, hemodialysis, done both in-center and at home, and peritoneal dialysis. And finally, conservative management. In this module, we will be discussing peritoneal dialysis. When should I start dialysis? Good question. You and your kidney doctor will decide when to start based on your labs, kidney function, and if you have severe symptoms caused by your kidney disease, such as shortness of breath, fatigue, swelling, muscle cramps, nausea or vomiting, or are having a metallic taste in your mouth. Dialysis is a procedure used to treat kidney failure. It does some of the things a normal kidney does, like removing extra water from the body and removing the waste products that have built up in the blood. Peritoneal dialysis is one type of dialysis treatment option. Peritoneal dialysis uses a part of the body as a blood cleaning filter instead of a machine. The peritoneum is where dialysis occurs. A thin lining called the peritoneal membrane covers the space and acts as a dialyzer for your blood. It is used to remove excess fluid, correct electrolyte problems, and remove toxins from the body. Peritoneal dialysis can be done either manually or with a cycler. I will talk about each one of these in just a moment, but let's talk about access first. Peritoneal dialysis access is done with a catheter. A catheter is placed into your abdomen through a surgical procedure. A small portion of the catheter will be outside of your body, but your clothing covers it when you're not using it. With manual peritoneal dialysis, the patient performs the exchange without a machine. A special fluid called dialysate is put into the peritoneum and stays there for several hours. Waste products and extra water move through the peritoneal membrane into the dialysate. Then the used dialysate is drained away and replaced with fresh dialysate. This is called the exchange. Cycler peritoneal dialysis is where a machine, called a cycler, does your treatment overnight. It does lots of exchanges at night while you're sleeping. Some things to consider for this kind of dialysis is that it allows for more freedom during the day to do what you want. It must be done for 8 to 10 hours, and you may also have to do a manual exchange during the day. Here is Marilyn Hardy, a peritoneal dialysis patient.
Well, my experience with peritoneal dialysis, I actually was about to go on a trip to go see my granddaughter, who's 8 years old at that time, and I was at getting ready to get on the airplane, and my kidney failed. So they gave me a choice for the peritoneal dialysis or the other dialysis, the hemodialysis, because I wanted to still travel, so I got the peritoneal dialysis so that I'd be able to still be able to travel. And also that the idea of doing it at home was more appealing to me than going back to the basement in the hospital.
What have been some of the difficulties with peritoneal dialysis?
It's not really been very difficult. It hasn't been very difficult because I have a great team of doctors that work with me at the clinic. And the hardest part is bringing those bags in every day and every night and making sure that my site stays clean so that I don't get infections. I'm still able to get out and garden, and me and my mom go different places. And I have traveled with my suitcase. They have a special suitcase for it, my machine. So yeah, I live a kind of normal life with the peritoneal dialysis.
Why did you choose peritoneal dialysis?
Being able to still see my grandchildren, travel with them, or being able to watch them, babysit them, those are just, my grandkids are everything. And the idea of being able to dialyze at night at home, other than sitting in the basement at the hospital for 3 hours, and then when you come off the machines at the basement, you're completely wiped out. You can't do anything for the rest of the day. Your days are just done. It's not painful at all because I don't cramp up like I used to when I would do the other dialysis. I don't, I can sleep through it because the cord is long enough where you can roll over, and I can sleep for the 9 hours that I have to dialyze. Sometimes I'll wake up in the middle of the night because the machine's going off, but most of the time you can sleep through it.
Would you recommend peritoneal dialysis to other patients?
I think I benefited from PD because I'm able to hook myself up. I don't have to go through all the pain. I'm able to garden. I'm able to go walking with my mom. I'm able to play with my grandkids. I'm able to go on trips with my friends, small trips, because the larger ones I'd have to mail my boxes. PD is just, it's just been a much more freeing experience than the hemodialysis is.
When you start peritoneal dialysis treatment, it is first done through manual exchanges. They are usually done for the first 30 days while you're learning. Manual exchanges will also have to be done if the electricity goes out. It requires a clean place and takes about 30 minutes per exchange. After the first 30 days, cycler exchanges can be done at night while you sleep. There are a few things to consider about peritoneal dialysis. Treatment is done daily, but flexible, allowing time for other activities and for you to do it when you want. It usually involves 2 clinic appointments per month. The treatment is gentle, so it causes less discomfort. Your exchange area must be kept clean. You must wear a mask while doing your exchanges to reduce the possibility of infection. Your catheter and skin should be cleaned daily, and you will need space for storage supplies that will be ordered for you by your clinic. And you will have less food and fluid restriction in your diet. We know that deciding on a treatment for kidney failure is not an easy choice to make. Today, we hope that you've learned a little bit more about your option for peritoneal dialysis. Congratulations! You've completed this module on peritoneal dialysis. Please check out our website for additional educational modules in this series on kidney failure and treatment options for failing kidneys.